Okay, everyone, welcome back. We're going to get settled and welcome our next panel. If everyone could sort of wrap up their conversations, I know it's so nice to be able to socialize, but we're going to go back to the program. Okay, so I'm welcoming now for a conversation about transformational healthcare investments. Shh. Thank you. We're gonna start the panel. I'm going to let Gregory Zuckerman, who is special writer for the Wall Street Journal, do the intro of the other speakers, and please join me in welcoming them.
Good morning, everybody. Hope everybody's having a good time. My name is Greg Zuckerman. I'm at the Wall Street Journal. It's an exciting panel we've got here about healthcare. Healthcare is a fascinating world where it's impacted by macro forces that we've all discussed the last couple days here, and yet there's innovation going on behind the scenes that really is not affected. And it's kind of long-term, it's revolutionary, it's changing all our lives, it's saving lives. So we've got a really unique opportunity here because we've got a provider in the middle, Jeff, and we've got two different types of investors, early stage, a little bit later stage as well. So they've got really interesting perspectives. And what I thought I'd just do is ask, starting with Annie, each of the panelists to give a quick introduction of themselves. Better they that do it than I do it.
Okay, Annie Lamont, you'll be the, is this on? Can you hear me? Okay. You'll be the judges of whether it's an interesting panel, I guess. Founder of Oak HCFT. I've been a venture capitalist most of my career. We were founded in 2014, have raised $5.3 billion in 5 funds. And it's Oak HCFT for healthcare and fintech. We do everything from early to late, $1 million checks all the way to $100 million checks. And we're just all about investing in the tailwinds in healthcare and fintech.
Thank you. Jeff?
Great, it's a pleasure to be here. I'm Jeff Flaks, the CEO of Hartford Healthcare. Our healthcare system is largely based here in Connecticut. We're the second largest employer. We have 35,000 employees. $5.8 billion in revenue and 430 locations.
Good morning, Colin Greenspon. I'm the founder of a fund called Narya. We are an early stage venture fund looking to put sort of $5 to $10 million to work per investment, really across all industries. We're true generalists. We tend to take a sort of very macro-driven view to kind of what we think the world looks like at any point in time, 5 to 7 years out, and then invest accordingly where we think there's a real edge in either sort of science or technology. And so we're doing a lot in healthcare, and that ranges from therapeutics to diagnostics, but also a look on the IT side. But we're also exploring opportunities in alternative energy and space technology, and so it's really across the board. And Narya is a new fund. We're at the tail end of doing new deals out of Fund 1, and we'll have a second fund up and running the next few weeks, and it's good to be here.
Thank you. So I thought we'd first provide a little bit of backdrop. We talked a little bit over the weekend, and there was a consensus that the healthcare system is broken, that there are real serious difficulties that we're going to have to address, and that's what investors do. They try to make money, and they try to make improvements and such. So I thought I'd start with Annie, that we can discuss it. What are the problems, and how are investors like yourselves attacking them, and how do you make money from those decisions?
Mm-hmm, mm-hmm. Well, we have a mission, and the mission in healthcare is very simple. Hey, Luke. Lowering costs and improving quality in healthcare. And we have a market, as you know well, that is somewhat dysfunctional but keeps growing. There's just inexorable growth. And so the fundamental problem is fee for service. I mean, you all know it. It's essentially people are incented to do things, and there's no incentive not to do things and to manage your care long term. And we have a fundamental view, and it's 20% of the economy now. It's so entrenched. It's literally the largest employer in every state in America. And so it's very hard to change things because you just have so many forces that are fighting change. Our view is that you really need to move, and you've heard this expression, value-based care. And so our view is you have to move the system so that doctors, starting with primary care docs, hopefully independent primary care docs, and Jeff and I can debate what he's doing in terms of owning primary care and how we think about it. But independent primary care docs really being responsible for the entire continuum of your care and paying the risk dollars for that. So that, our view is that is the only really fundamental way to change this paradigm of fee-for-service and people wandering around the healthcare system and being charged, and somebody being charged, not necessarily a patient, although the patient is taking part of it. The only other thing I'll mention is 25% of healthcare cost is now pharma. That is double what it was 10 years ago. So that is just, that's something that we'll talk about here, I think, a little bit, because we have to be addressing that in different ways. And clearly some of that is just, we have some amazing life-changing drugs that have come about that are incredibly expensive, but we also have a system that is a little bit broken in terms of distribution.
And Jeff, you both run a system, help run a system, but make investments. Tell us kind of where the innovation is coming from. Where are you putting your money right now?
Yeah, I would start I completely agree with Andy's comments. The status quo isn't acceptable in healthcare today. If access is a tremendous problem. It takes 10 months for people to get an annual physical. People with cancer diagnoses often have to wait 3 to 4 months to get into treatment. When we look at affordability, the cost curve and the price of healthcare must be bent. It's not sustainable. When we think about quality and excellence, it's inconsistent. And I think the most important issue is look at health equity. Right? If we've learned anything through COVID, the inequities in healthcare are completely unacceptable. Right? In fact, we operate a hospital in Bridgeport that's basically on the line with the town of Fairfield. The life expectancy is about 20 years difference if somebody's born on the Fairfield side of the line,
wow,
or if they're born on the Fairfield, on
years.
the Bridgeport
Wow.
side. So totally unacceptable. So we have to change, and to change, we have to dramatically disrupt ourselves. Our health system today. When I started at Hartford Healthcare 18 years ago, 70% of our revenue was generated by the hospitals. Today, the hospitals are generating about 45% of the revenue, and that's been purposeful disruption. So we've invested tremendously in home care. We're the largest home care provider in the state of Connecticut. The future of healthcare is going to be in the home. Home monitoring, hospital at home, and we're going to see physicians now who are going to be treating people in the home. A much less expensive place to do it, where you can do it with much greater internal controls. We're going to see behavioral health being done inside primary care offices. We're doing it now in urgent care centers, and we're providing behavioral health virtually in very significant ways. So to me, we've invested heavily in virtual care, behavioral health, we're investing heavily in home care, and we're investing significantly in what Andy described around changing the way we're paid. So first, 4 years ago, we got an insurance license. We partnered 50-50 partnership with Point72 out of Boston, and we created our own Medicare Advantage plan. And it's been a slow growth learning process for us. But most recently, we partnered about 6 months ago with Optum, and we have a 50-50 partnership where we're creating our own risk-bearing entity that will be payer agnostic, that allows us to contract with all payers, initially in Medicare Advantage, but moving towards commercial over time. But I just want to underscore, my final point would be what Annie said. We have to get paid for outcomes, and we have to get paid for the total cost of care. And providers like us have to move away from getting paid for the more you do, the more you earn, or even the more mistakes you make sometimes, the more you earn, or the less efficient you are, the more you can get paid. So the movement to value-based care and to being paid differently is really the most fundamental thing we have to do. But then systems like us have to become ecosystems, and we don't need to own everything. We just have to ensure that we can coordinate the care and manage the care, because we have to move away from transactional care to highly integrated care coordination.
Colin, you want to tackle that questions?
Yeah, sure. So I agree with most of what you both said. There's this interesting question. We're talking on this panel talking about sort of transformational investments in healthcare, and as an early stage investor, I sort of need to sort of separate my role as put my investment hat from sort of my citizen hat and my father hat on sort of all my frustrations with how expensive it is to pay for bills when my son broke his wrist, or how long it takes to go see a doctor, and that's very frustrating. But I see this industry as one in which very different than a lot of industries I invest in, one in which there's certain things that startups can really do to move the needle, and there's other activities where sort of the government and the bigger institutions like yourself really need to sort of do it from the top down. And there's some symbiosis there, but where we're trying to play, at least on the IT side, is more sort of around democratization of data and getting folks more information so they can make better decisions. We have a company doing that in Medicare Advantage, for example. And then where we spend a lot of time is actually investing in more of these sort of these higher risk kind of binary outcome companies that are more on the therapeutic side, that are really sort of pushing the curve on the innovation side for creating new drugs. And because I agree on the value-based care side, it's really important and we need to move there, and we're looking at all sorts of different business models that are pushing that on, on the cardiovascular side or more generally, but it's always hard to sort of get the flywheel going at a startup, and I would think with the dollars associated to do that the right way and the sort of the covered lives, it's almost easier with the right initiatives to do it from the top down.
Thank you. I thought I'd follow up with Jeff for a second. You said something really interesting, and frankly, we didn't prepare this ahead of time, so you may not have an answer, so I apologize to Jeff and the audience. But you said the future is the home, which I thought kind of fascinating because we all we write stories about hospitals and the spending going higher, and I didn't realize as a percentage it's actually going lower. Give us a couple names or one name of a company that either you've partnered with or just have noticed that's doing really interesting work in the home, healthcare in the home, doing innovation, revolutionary maybe kind of work. Is there anybody that comes to mind?
Yeah, I'll tell you, it's interesting. For a number of years, I took a lot of pride in saying that we were within 15 miles of every resident in the state of Connecticut. And we set the ambition to be within 10 miles of every resident in the state of Connecticut, which we achieved recently. I no longer speak that way, because what we want to be is in everybody's home.
Huh.
Now, it doesn't mean we're providing home care services in everyone's home, because not everyone needs that on any given day, but we're in the palm of your hand. We're there because we can provide virtual care, real time, for whatever your need may be. And we just did a very interesting partnership with One Med. And One Medical was just in the process of completing the acquisition process acquired by Amazon Health. And we're building 5 One Med offices here, Darien, Stamford, Westport, Fairfield, and New Canaan. And those offices are set up where they're capped at 1,000 patients basically per primary care doctor, but we guarantee 24-hour access to virtual care. So anyone who has a need, wherever you may be, can get access to a provider through virtual care. And if you need to be in the office, because of the cap that's in place, you have more immediate access. These are the types of innovations to me that are exciting, and specific to home care. There's Optum has made some very interesting investments where they're actually looking to put physicians who are going to be seeing house calls, where they're going to
like
be
in the
providing
old
house
days.
calls,
That's great.
just like the old days.
Yeah.
And we are putting now hospital beds for hospice
Really?
in the home, as opposed to having people come to the hospice.
Yeah.
You can do it better and actually preserve people's dignity and give them much better service in the family, better service if you do it in the home. So
That's beautiful.
There's tremendous opportunity in the home.
What's the company? I'm sorry, Optimum, you said?
Optum was part of a partner with United Healthcare, has invested heavily in that space.
That's fascinating. I mean, those of us who've experienced institutions, I'm sure yours is the exception, but sometimes it could be frustrating and disappointing experience. So just by definition, it's hard as an institution. But if you do it in the home, that could be revolutionary.
The other piece I just would say is home monitoring. If you think about chronic disease and the issues that people have, the ability to manage diabetes, to manage heart failure, kidney disease, end-stage kidney disease, this is where massive amounts of the money in the country is being spent. Massive amounts of money. And the amount of hospitalizations and readmissions that could be avoided, the amount of pharmaceuticals that can be conserved if done properly. But you need really sophisticated, advanced home monitoring, and you have to figure out a way to get paid for it. And the same thing with virtual care. It's been resisted. If you don't figure out a way to get paid for it, right, there's a disincentive to do it. But those are the innovations that we need.
And I assume the pandemic has accelerated that. We were all getting a little more comfortable talking to our doctors on the phone kind of thing. At first we were uncomfortable, but it's not so bad after all. Yeah, I don't speak in person. Annie, I'm going to ask you, when you think about healthcare and issues, you think about rising costs, you think about staffing issues. What innovations are you seeing out there in those regards? How are people tackling those issues, and how can you make money off it? Hypothetically?
Okay. We're talking about that. I think we all know about staffing costs increasing, and particularly on the provider side. I mean, Jeff is dealing with that every day in terms of bringing in clinicians. I'll say, one thing before I even go into that is people always want like really exciting AI. Let's talk about like innovative, things that are going. There's nothing innovative going on in healthcare. The reality is it's just improving the system, making it better with technology that already exists, and we're like 20 years behind, as most of you know, in terms of using things that already exist out there. So, One Medical, we were actually the founding investor in One Medical, and that was just applying, open table, like, okay, you can go online, you can talk to your doctor, through email, text, we'll prescribe on a weekend for you. I mean, this is like really simple stuff and giving people a good consumer experience. And that was 15 years ago when that was started. Right now, I think in terms of lowering costs, the great news for me is that hospital systems, Jeff may debate this, but we have actually avoided selling software and solutions to hospitals because it's complex, everybody wants something different. They were all focused on implementing EHRs. They really just wanted things that aggregated revenues. They weren't as focused on efficiency. And the exciting part to me actually about the staffing issue and where we are today is that hospital systems and healthcare systems are very focused on it now. And we have, a couple of incredibly interesting companies that, Jeff may be talking to a few of those. And I know, where you're simply digitizing things that are being done by, 500 laborers looking at a spreadsheet, so it's the simple administrative things that we're starting with. But we're also looking at things like call center. Like nobody actually talks about call center. How much money do you spend on call center at Hartford Healthcare?
Yeah, tremendous amount. We employ 500 people.
Yeah,
Wow.
right. So over 100
Are they in
million.
America?
Yes.
Yeah.
So I know, HCA spends like $200 million on call center.
Wow.
It's incredible. And, we have a software solution that basically, and 2% of people, when you go to a website of your healthcare system, you're talking about 1 to 2% of people actually convert to making an appointment. It's sort of a useless, they've actually, what they've done is integrated website, calls, voicemail, email, all in one place, and are reducing the need for a person to actually talk to you by 60%. So they're literally taking $200 million of spend, down to about $40 million of spend and providing a much better solution. I think HCA found that 30% of the first calls that they were getting to make an appointment were not being answered.
Not being answered at all.
Not answered at all. This is in HCA. I was on their board for a while, so I know them. The reality is, it's probably the most well-run hospital system, other than Hartford Healthcare in America. And so, for them to find that, they didn't know that. They didn't know that until they did the diagnostic with this company, Syllable, and are now implementing this, across the system. So, there are things like that that are just like simple ways to improve processes.
I thought I'd ask Colin, you talk to entrepreneurs in many industries, but including healthcare. What are you hearing in terms of their mindset right now? We're going into likely a recession if we're not in one right now. Regulatory change is something of interest and of concern for a lot of the entrepreneurs in this space. What's the sense you're getting from the entrepreneurs?
Yeah, I think it sort of depends on the stage of the company, but I think we can debate whether where we are in a cycle right now, and there were some good discussions on that earlier today. But I think for the right entrepreneurs that are building truly transformational businesses that are going after sort of need to solve, not nice to solve problems, they will be just fine. There's plenty of capital out there at sort of early stage and growth stage. And I've seen some valuation compression, but it's still just a lot of funds sort of fighting for the best deals. And so if it's an interesting opportunity, the metrics are intriguing. They're going to be fine from a fundraising standpoint. And I think from engaging with strategics, there seems to be everyone seems to be open for business and really looking to collaborate. And so I actually think it's a really good time for entrepreneurs, assuming the extent they have metrics that are actually relevant and sort of those unit economics are tight, and there's a path to sort of growth that is, that is somewhat, they're controlling their own destiny versus sort of this deep trough that was okay a couple of years ago and coming out steeper. And then for the companies that are, pre-revenue and sort of pre-traditional financial metrics, I continue to think there's a lot of capital there. One of our biotechs, despite what's going on in the public markets this year, had one of the biggest private rounds a quarter ago, and so I tend to be very optimistic.
Huh.
And then just on the innovation side, just seeing a lot of these sort of less pioneering advances in science, but sort of this kind of second wave where the biology has been proven out, and now there's different business models to go after, things like gene therapy or these new sort of upstream and downstream CDMO models to help on the services side for especially in advanced therapies. And so I'm actually pretty optimistic, especially on the therapeutic side.
So you as an investor, you're not getting much better terms than a few months ago. You're not getting the same, people reducing their demands. You're not getting bargains that maybe one would have thought given the macro challenges out there.
Yeah, I would say that that's probably true. We only do a couple deals a year, and so I haven't done a new deal since June. So I don't have the best data on it, but as far as our company, we have 3 companies raising now in different sectors, one in healthcare, and they should have pretty good up rounds.
Okay. I'll shift back to Jeff for a second. You do strategic deals, work with companies. Make the argument why that is a better move for these companies, working with a health provider like yourselves.
Yeah, I'm a tremendous believer in partnership and taking advantage of the innovation from firms like the 2 people I'm here with today. The amount of innovation, the amount of money in private equity that's being invested in healthcare today is really beyond anything certainly I've ever experienced in my career. And I'll give you one really good example. We've had great success with a TPG-backed investment, Go Health. And Go Health, which began out in the West Coast, we did an agreement to develop a Go Health urgent care center network across Connecticut. We have about 25 with about 5 under construction today. And we did urgent care for years, and we muddled along. Go Health, with the right level of innovation, technology, money behind it, bringing together the right talent, has totally revolutionized the way urgent care is provided. And our net promoter score is now around 90 for urgent care. And we went from doing something like 60 or 70,000 visits to this year, we're going to go over 600,000 visits. And it has become an integral part of our healthcare system. But what I would point out, and I think this is really critical, when organizations like ours partner, we're not partnering kind of in an episodic or transactional manner. It has to be through integration. So when we partnered with Go Health, it's our electronic health record, we credential all the providers, and we integrate all of our imaging and laboratory and ancillary services into the Go Health model. So from the consumer experience, you're not just simply getting your need met. It's part of your longitudinal healthcare. And to me, that's the value of partnership. Go Health could build, independent of us, a network of urgent care centers in Connecticut, but they simply would be solving one problem. But when they built it in partnership with us, from the consumer perspective, it becomes a permanent part of your health record. Your provider knows electronically before you even leave why you were there. And all of your care and records and history is fully integrated, and all of your lab findings and so forth are sent to your healthcare team. So to me, partnership is critical. And places like us aren't great at inventing things, but we are a great sandbox. So we do support, we have a healthcare accelerator. Our mayor, Luke Bronin, is here from the city of Hartford. Luke's been an amazing partner of ours, but we work with the city of Hartford. We have a healthcare accelerator that we've co-funded. We've got 15 startups that we've brought in that we just give them the keys to the car. They get to come in our organization, and they get to develop their companies from the confines of our organization. We've done the same thing with Israel, with the Economic Development Forum in Israel. We're one of 4 US-based health systems that bring companies that need to domicile, that were invented in Israel but need to domicile here, early stage, and we do it in Connecticut. Wow. So I'm a huge believer in Connecticut, and I think it's a wonderful place to originate these companies and we have a culture in Connecticut that supports it.
Is that unique? I have no idea. I wasn't aware this was happening. Is that unique to your system, or all over the country, providers are having cutting strategic deals and alliances and joint ventures?
There's probably 50 to 100 health systems like us in the country who are working along those same lines. Andy even knows better than I do. It's probably a continuum of how innovative they are.
Andy, do you want to give a couple thoughts on that?
Well, I think it's interesting because we'll use Yale New Haven as an example. They're about to buy 3 more hospitals. We were talking about it earlier, and that's a model of we're just going to keep doubling down on hospital. We know hospital, we're going to do hospital. So you see that a lot over the country. But I think if you are thinking about the future, you've got to be thinking about an vertically integrated model, as Jeff is doing, because we are going to have. I mean, what's happened really, you've seen it in the last 3 years with COVID. Now you actually have fewer people in the hospital and they're more intensely sick. So we actually don't need more beds. Even with demographics, it's like you don't need more beds because we are handling many people that used to be in the hospital system, and we're trying to keep people out of the hospital system throughout the continuum in healthcare. And if you're going to think about value-based care, then you have to think about other ambulatory, virtual, in the home. You just have to think about these other venues because you've got to think about right time, right place, right care. And so I think Jeff is definitely thinking about it in the right way.
When you do these deals, I'm just curious, do you take an equity stake? How big an equity stake? Is it always an equity stake? How does that work?
So we typically are at least 50-50 partners.
Huh.
Sometimes we may even have a greater percentage. We did one thing that's rather interesting. We work with MIT, and we developed a company that's just in its early stage. It was recently formed called H2O, which is a predictive analytics company that's focused on operating room efficiency. But the dean of the analytics program at MIT, Professor Dimitrios Pertsimis, worked in Hartford Healthcare for several years with his PhD students, built this model. So we have a smaller percentage, a relatively small percentage of that company. But we earned that percentage by being a development partner with Professor Pertsimis and the company he formed.
As opposed to investing. You didn't have to put up any cash, you're saying?
Correct.
That's like a win-win.
Or limited cash.
Yeah. If it works, great. If not that much effort on your part or risk on that part. Have there been any huge home runs in that world where a provider has gone in a strategic deal with someone, a startup and such, and any that you're aware of? I was just curious.
So we had one company, which goes back almost 10 years, which is really exciting because it was formed in our organization, and the person who was kind of the primary developer ended up forming a company called Premise, based on the product that was developed within Hartford Healthcare. Ultimately, he sold it to Eclipsis for a significant sale price, which then resold and became the foundation of really of Allscripts. In many ways. So, it does happen, and it happens all over the country.
It's interesting. Thought I'd ask Colin about just sort of, as the healthcare system evolves, there are ways, there are trends that are emerging that maybe aren't as investable as others. Maybe there's some that, and yet they're important to all of us in this room. What should we be aware of? What kind of trends are out there that you guys are seeing?
I mean, I think we talked about at the beginning of this panel, just the push to value-based care is a huge one. And again, for us, it's this question of as an early stage investor, what data can you get to get comfortable? Not that this is something that should be done, but that this team has an edge to go do that. Is it a partnership with an interesting health system? Is it some technological edge? I'm also there's a lot of low-hanging fruit here, but these companies are really asking for capital without a lot of data, and so it becomes this almost a founder bet and a macro bet, which for us we tend to want to sort of underwrite to sort of tech and scientific risk. So we do a little bit less of it. I also think I talked about the democratization of data. I think especially in the Medicare space, just with an aging population, there's a lot of confusion around the open enrollment process and what sort of plans are best for which people and when they can switch and how that all works and what those economics are like. And so we have a company that is actually started by some ex-Palantir folks that, they were doing some healthcare within Palantir, but are trying to take a very data-driven approach to go after on the brokerage side, go after some of the big public companies that we would argue have struggled to do that. And so those are some themes, maybe bigger themes that, maybe this isn't exactly what your question is, but one of the things we're pretty passionate about too is this idea of doing more domestically, sort of from the bottom up, and that's everything from producing, KSMs, key starting materials, and active pharmaceutical ingredients here in our country, for a bunch of reasons. One, just from a timing standpoint, if there's another pandemic, it's very, very hard with supply chain disruption. It improves the unit economics as well, so that should sort of trickle down to everyone. And then also just from a national security standpoint too, if you think about sort of where those ingredients are manufactured, if there is ever, for antibiotics and whatnot, I think it is important. And so we're looking at some of those themes as well.
Annie, do you want to give your own thoughts on the kinds of companies you're talking to, the entrepreneurs, and what kind of trends, if you're seeing any of those similar trends?
So one thing, social determinants of health, I don't know if you've heard that expression, but it really is talking about, nutrition, housing, all those things that affect the well-being of an individual, mental health, and incorporating those. And we do have a few companies, one in particular that is literally state by state going and incorporating, creating a network so that one can track actually, there are benefits that exist federally and state-wise, but they're not coordinated at all. Just think about SNAP program is, the food stamp program, and then you've got HUD over here, housing, and then you've got HHS, so totally separate, and mental health, dealt as a separate issue. And those are really, when you look at Medicaid, when you look at actually, issues of our U.S. Health status, that's what drives most of the health problems in America. And yet we don't coordinate those. We're not thinking about it that way. I mean, in my mind, the vision of the next, administration would be like, let's put all these buckets of money together, because it's now happening in some of the states. They're trying to coordinate this. And there are companies that I said, this company has now grown to 100 million. And it's working with 16 states across the country. This became even more evident during COVID, and just aggregating that information, tracking individuals, which has all sorts of HIPAA, issues. But if they haven't, taken advantage of a Bennett, actually getting them there, thinking about housing. You actually have United Health. You have major insurers that are now doing experiments, and Phoenix is one place where they've literally bought housing and are putting individuals in housing that are chronic users of the emergency room, and are finding great success in actually lowering total overall costs. So, thinking about that.
So in other words, an emergency room that would be in the hospital itself.
No, I mean, what I'm saying is these people, literally they're people that show up in the ER every week, every other week.
Yeah.
And most of it is related to homelessness, mental illness. So, if you can think about those people in a different way, and a lot of it is homeless, starts with homelessness, and then, you figure out they're getting, food benefits already, but, supporting the whole person. So, we just got to think about this. I mean, childhood diabetes went through the roof the last 5 years. You're talking about like 50%. I mean, it is insane. So, these are the things that we're not dealing with as a country, and you cannot deal with it at a micro level. You got to deal with it at a macro level. So, in terms of trends, I mean, we all know mental health. That's obviously, a serious issue, and one thing we've invested quite a bit in. And the good news is there's a lot more money for mental health that came out of the COVID, and people are talking about it, and they really weren't talking about it 3 years ago, pre-COVID. So that's a bad thing and a good thing. Yeah.
And money is flowing into mental health right now. You're
yeah.
seeing that everywhere, right?
Yeah.
Too much money? You think it's just...
Oh, no. God, no.
It's all, it's all necessary.
No, I mean, obviously the issue is figuring out the clinicians, and I think there are a lot of social workers that have been on the sideline, and with virtualization, we're now like bringing them back into the fore, and people can work 4 hours a week or 20 hours a week, or raise their kids. They don't have to go into facilities. So that's been actually huge in expanding the workforce in areas like mental health. Sorry.
Interesting. I want to leave about 5 minutes for Q&A if there are any, but I just had a couple more questions. Speaking of mental health, and again, we haven't talked about this before the session, so I'm going to apologize if you have nothing to say about this. But one thing I'm really fascinated by is the revolution in psychedelics and how many kind of mainstream people I know, hedge fund managers, private equity guys, who over a beer will say, you know what, Greg, I've started to microdose. And I'm like, wow, you would never expect this whatsoever. And it seems like it's sort of like marijuana was years ago, where it went from, crossing that line where it's becoming more acceptable. And it's being able to address things like anxiety and PTSD and marriage counseling and such. So the little that I'm detecting, I'm not recommending you try it at home, but if you do, let me know. I'd love to write about it. I'd love to hear what if you guys have any perspective on, is this the next marijuana? Is it the revolution? Is it something that we as investors should be thinking about? Or, yeah, maybe down the line, but it's too early for guys like us. Do you want to start with any?
No, actually, this is a politically sensitive topic that I will not comment on.
That said, no, okay.
I actually think there is a bill that's being proposed in the next legislature around this topic, and people are looking at it and they're thinking about PTSD.
Yeah.
I mean, these things start, and there's credibility, obviously, if the armed forces is supportive of it and they believe, and there are actually clinical trials of PTSD that are quite successful. So
that's when somebody like you would get involved, when serious investors are waiting for.
Yeah,
it's too early.
We will be waiting a long time, probably.
Okay.
Yeah, I'm not sure we would invest anytime soon, but there have been a few companies that are going after this, and the early science is pretty interesting. As someone who was living in the Bay Area for a long time, there's all sorts of experimenters, and with the Burning Man crowd or whomever, sort of the kind of the tech world that have talked about this, and not just for sort of obvious health reasons, but even just for sort of coming up with new investment theses. And there's a whole pretty small community there. I don't think that's really an investable market at this stage, and I would be pretty nervous about the regulatory environment. So I think it's something we would watch, and we're never sort of kind of pioneers when we invest. It's always looking at that next wave, and so but I think it's pretty interesting.
Jeff, what about you guys? Are people taking trips on the
I would only add the other side of it, which is we and I do think an area that's getting a lot of investment also is addiction treatment centers. And there is a lot of focus on addiction treatment centers, and I think it's an emerging area.
Yeah.
And I think we're going to see more private investment in those spaces because people can do it well and make it more accessible and more affordable.
I don't think you can get addicted from what do I know about psychedelics. Right. I've never tried it, but I don't think there's an addiction issue there. But maybe there is. I don't know. But it's not something you guys are looking at this early studies and thinking about treating people with anxiety or talking about microdosing, that kind of thing. All right, let me know if you do. And the other question I had was, you had mentioned, Jeff, specifically about Amazon. What's it called? Amazon Health? Amazon, yeah. And there have always been kind of concerns or interest in Amazon and the behemoth out there, and whether they're going to make a big impact on this industry. What kind of impact are you seeing? What kind do you expect? Is there somebody like Amazon, Google, or Apple? People talk about Apple and the phone, and et cetera, and that being the future doctor and monitoring you, et cetera. Tell me about those companies specifically, but also just kind of those innovations, maybe coming from big tech.
Yeah, I think it's all the above. Right? Walmart has significantly focused in investing in health. CVS, right, is looking to build these health hubs and become the front door, right, to healthcare in many ways. Walgreens, and something Annie was involved with, has significantly invested in primary care through Village MD. So when you think about all the different companies, and Amazon is clearly, looking to move in this direction, the vast majority of these large public companies who work with different levels of, with consumers, whether it's through e-health or through physical locations, they all have potential to have great impact in different ways. So my point of view is, as a regional healthcare system, and I hope this would be the point of view candidly around the country, we shouldn't resist these organizations. We should look to partner with them and figure out ways to make healthcare more accessible, more affordable, more equitable, and raise the level of quality. And they may very well emerge to have a lot to offer. The example with Walgreens and Village MD, they're proving it right in parts of the country. So.
And it's successful there, yeah. It's an effective program, yeah.
In some instances, not all. Some haven't succeeded. Some have restarted. Some have reorganized numerous times. Google Health has reorganized numerous times.
Yes.
We're talking to Google, though, very actively. I think we have to remain very open-minded, because I think it comes back to this basic premise. We have to disrupt the status quo. Healthcare's got to change. We all said that. So to change, so we have to be very open-minded and objective and continue to seek. I often use the analogy where it's like salmon swimming upstream. They don't all get upstream, right? We know that. But you have to just hope that you make good selections, you pick more proven partners, and if you fail quickly, right? And make sure your bet that you're putting on the table is measured. You have to be willing to fail. We're not going to change it if we're not. We can't be that conservative, when you're trying to address a historic situation that, absent being addressed, the impact it has in this country is put the country at great risk.
Colin?
Yeah, I would just add, Amazon's going to get all the headlines, but you're seeing that trend from less tech-forward companies too, and so any sort of national grocer that has pharmacy capabilities is really pushing on this as well. So you're sort of seeing the less tech-savvy folks come after this opportunity.
Do you have any thoughts on the big tech coming into this space?
I'm not particularly worried about it. I mean, we just keep seeing them. Apple is not really making an
Speaking
impact.
of Apple. There you go.
Yeah, I mean, they look at everything in a tech way, and it's really a services. So, no, I'm not really. I think Amazon's the only one that's really making some bold moves, and I'm excited about that. They know how to serve the consumer in a different way, and they're willing to try and fail. I mean, I'm not very happy about what they've done with our local Whole Foods, but.
All right, that's another panel. We'll get to that another time. All right, we only have a couple minutes left, so I thought I'd ask, there's a Q&A. I see a hand going right back there.
Hi. Thanks so much for the terrific panel. Question for you that picks up on some of these themes of addiction and mental health. A dear friend of mine started a community health center in downtown Westport, our beautiful home state, called Lift Wellness. And as she thinks about growing her business, should she think about that as a healthcare business? They're doing eating disorder recovery and similar, or should she think about that as a real estate business? Where is the capital coming from, and how should she look at scaling?
Everyone want to take a shot at that?
Well, you probably know more about real estate. We actually shy away from real estate plays. So I'd like to think that's all about the care of the individual. So I definitely think of it as a healthcare company. And real estate is secondary. I mean, you have to have a strategy that makes sense for you if it's facility driven. I would certainly encourage a strategy where it's sort of omni-channel.
Jeff, you want to tackle that?
I would only point out, healthcare has become consumer driven. And, so the notion of these types of locations, they're retail locations today. So I think you have to have an element of a retail strategy that's viable. But I would just echo Annie's point. I mean, it's healthcare services they're providing, but location really does matter and does impact, access, which is really crucial.
Okay, I have another question right in front here. I think
You've addressed the cost side of healthcare and how to reduce the cost. You haven't addressed, to any degree, the method of paying for it. For instance, one method we could have used when they passed the last tax law under the previous administration was they repatriated money back. Corporations could repatriate money back at a reduced cost. From 30%, I don't know if it was 30% down to 20 or whatever. What about taking half of that money, putting it into a fund that the government could not touch, and that fund would grow through investments over years, which would offset the cost from 50-year-olds on up, where you tend to have the majority of costs occurring, to offset that money would come from that fund as a supplement to one's payments. Additionally, another method could be deducting your monthly payment or your insurance payment annually from your income taxes. Now there have to be controls on that, because obviously there's no incentive to avoid the cost for the insurance company to keep charging more. So there are ways to do that, but just that concept I'd like you to address, if you can.
Well, I think there certainly could be more creativity around funding mechanisms. I just legislatively, the inertia around that would be very, very difficult. I think there are obviously other smarter ways to do it. In my mind, we're still spending 80% more than other healthcare systems around the country. Other countries are spending on healthcare. So to me, it's yes, we could be funding it differently, but we could be spending a lot less money than we are providing better care. So, and that's our focus.
All right, we are literally in our last seconds here, so I want to thank the panel. I think I could speak for them to say that you guys will be around afterwards if people want to come up and have questions. I know I'm going to be at a table over there that they asked me to go sit with my books, but some experts in the field, so people, if they'd love to come up and ask a few questions outside, I think I could speak for them saying people would be thrilled to meet people. Thank you for everybody's attention, and have a great day.
Thank you.